Welcome, everybody. Hi. Hi, everyone. My name is Verity Pacey. I'm the Associate Dean for Graduate Health Education here in the Faculty of Medicine, Health and Human Sciences at Macquarie University. And welcome to you all to our beautiful campus here, the Wadamadigal campus of the Darug Nation. We also have a number of people online tonight, so a big welcome to them as well. We know that you are there too. During this evening, we're going to have a live panel Q&A with some of our staff, students and alumni from the Macquarie MD. You're also going to have the opportunity to hear from Professor Vincent Lam, who is our course director of Macquarie MD as well. But just to start proceedings, I would just like to acknowledge the traditional custodians of the land.
Welcome. We acknowledge the traditional custodians of Macquarie University land, the Wadamadigal clan of the Darug Nation, whose cultures and customs have nurtured this land since the Dreamtime. We pay our respects to elders past, present and future. We welcome people of all nations and all faiths. Kwai Bidja, Jamna Payala Janawi. Come here, we speak together. We have 60,000 years of archaeological evidence of Aboriginal habitation at Lake Mungo and 20,000 years in Ryde. We have great antiquity. Today, hundreds of Aboriginal and Torres Strait Islander people graduate from Macquarie University. The Darug Nation had famous leaders such as Chief Yarramundi, Naraginji, Colby and Maria Locke. Many of the descendants of these Darug people live today amongst you. We celebrate with you our ongoing attachment and custodianship of this country. We celebrate the achievements of Macquarie University.
I'd like to pay my respects to elders past and present and any Indigenous people here with us this evening as well. After today's session where we hear from Vincent and we have the panel Q&A, there'll be the opportunity for some tours here on the facilities for those of you who are in the room. And for those of you who are online at home, we have a virtual tour for you to watch as well. But for now, I would like to introduce you to Professor Vincent Lam. Vincent is a surgeon. He's the Professor of Surgery here in the Macquarie Medical School. He is also a surgeon at Westmead Hospital in hepatobiliary and pancreatic surgeon as well. So Vincent, thank you very much for coming up and letting everyone know about Macquarie MD.
Thank you, everyone. I look so young 8 years ago. I guess that's what medicine do to you. So we show you a video.
When I was about 10, I can remember having this beautiful old piano my grandmother Nonnie used to teach me on. She had such strong hands.
I grew up in inner city Sydney. Our neighbourhood was a melting pot of people from all backgrounds and beliefs.
As Nonnie got older, after playing the piano, her hands would get so stiff and painful.
I started volunteering and I was exposed to people from all walks of life.
I went with Nonnie to an orthopaedic hand surgeon. He explained to me the delicate intricacies that give us dexterity.
Then I went on student exchange where I stayed with a family of doctors, and I learnt how medicine improves the lives of vulnerable communities anywhere in the world.
Our Macquarie MD program aims to prepare future leaders in healthcare who are patient and safety focused, culturally responsive, and equipped to work in increasingly digital health systems. Macquarie University is the only Australian university that owns its own hospital and clinics, integrating education, research, and clinical practice all on the one campus. Our students will have extended exposure to international clinical experiences. They will develop cultural responsiveness and learn about different health systems, preparing them to work in multicultural Australian and global communities. With a small student community, The program aims to provide an exceptional student experience to the next generation of doctors, setting a solid foundation for the practice of medicine in an ever-changing world.
Watching Nonny play piano after surgery, I knew what I wanted to do.
I knew my purpose was to help communities in need all over the world.
Realize your calling.
So welcome again. I guess this is, I assume that all of you wanting to do medicine, that's why you're here today. I guess I'm here to explain to you the structure of our MD program and what's the difference compared to other medical program in Australia. So it's a 4 years graduated entry program, so you need to complete your undergrad degree. And I guess the unique aspect is we are probably one of the smallest medical school that in the country. We only had about 80 students per year. So every student tend to know each other and they support each other along the way. Compared to some of the Sandstone University in Sydney that they have close to 300 students. So I guess it's the bigger it is, there are times that they will have students that sometimes fall through the cracks. I guess it's at Macquarie because we are relatively small, that we tend to know every student. And also one unique experience for our students is there is an opportunity for all the students to go to India for clinical placement, which I will talk about more. Every university talk about their innovative that they will do the interprofessional learning, patient-centered care. But we're very proud that at Macquarie that with, in particular in our faculty, that we work very closely with our other courses like physiotherapy, chiropractic, and all the other allied health courses, that we do have opportunity to work together, in particular with the doctor of physiotherapy student. And we are using a lot of simulation to prepare you to get to the real world. So in year one, that you will have the basic science subjects that, in particular for those students that didn't do science when they are in their undergrad degree. But also at the same time, we introduce them the clinical skill in clinical practice and also evidence-based healthcare. In particular, also is that this is a time that we introduce you to start to talk to patients and also work collaboratively with other healthcare students. In year two, that's when you will have experience in clinical placement to see real patients. That we are building on the left, the 3 separate blocks, that primary care, well-being, and cancer. And the second block is musculoskeletal, neuroscience, and aging. And the third block is everything else, that cardiology, respiratory, gastroenterology, surgery, and metabolism. So each of the group of the student will rotate in these 3 blocks, and also will have placement related to those medical specialties. And at the end of the year, you have 1 block of 8 weeks that have critical care, patient safety, quality, and also research that will combine together a very busy year 2. And hopefully this is what we call the stage 1, that is the relatively non-clinical year that will prepare you to your clinical year in year 2, in the stage 2, which is full on. When you can see in here, that is 36 weeks of clinical placement. On top of that, there will be some assessment time and orientation, boot camp also in between. We have 2 streams. I'll just share with you the first stream. This stream is the international stream. As I mentioned, that every student will get to go to India for total of 13 weeks. They include 1 week of the orientation. And the other time that you will have 13 weeks at Northern Beaches Hospital, and also 13 weeks at Macquarie University Hospital. And we also embedded out of these 36 weeks, the time 1 day a week with the general practice, and also 1 day of research. So it's actually very busy year in the third year. I don't know whether many of you watched the news in the last couple of years that talk about there's a GP shortage, that no one, like the number or percentage of the medical graduate choosing general practice as their career have dropped significantly. So in response to that, we also have developed a GP intensive stream. There's a application process that occur in year 2. So a selected number of the students will join this GP intensive stream. And this group of the student, unfortunately, don't get to go to India, but they will use the 13 weeks to do more general practice related activities in year 3. And also that there are other activities that they will be expected to do in year 4. Otherwise, the structure is the same. They still have the longitudinal GP practice 1 day a week, and also the research. And you can see that in here that every student will do at least 6 weeks of medicine, 6 weeks of surgery, 6 weeks of pediatric, and 6 weeks of obstetric and gynecology. That's how we ensure that you have the core skill together with the general practice in year 3. So those are our 5 main clinical specialties. In year 4, it's more fun because you have critical acute care. Basically, it's like that includes emergency medicine for 4 weeks. And also you have the mental health. Each of these blocks 8 weeks. And then you have 8 weeks of elective placement, which means that you can go anywhere in the world that in a medical facility with approval. And also the selective is our partners clinical placement that you can do during the 8 weeks period. Usually that you will be a 2-4 weeks rotation. You can choose to, student go to Africa, few go to China for the elective. They can choose anything. And the selective, we also have the student can go to India again if they like, to the Apollo Hospital. Also, we have partners in the Northern America, in United States. But students usually tend to try to look for their own, with their own interests, and also take on a holiday. So to choose a elective, as I mentioned, that is a student initiated. They can deepen your understanding of anything that related to medicine. You could try to contrast the different healthcare system and how patients are managed differently when you're in a different healthcare system. You could do it anywhere. But recently we do have students tell us that they want to go to part of the Middle East, and we say no, because I guess it's your safety also is a #1 priority, and we want to make sure that the students are safe when they're doing placement overseas, and also they will complete their study while they're with us. You can imagine if you are in Saudi Arabia and then there's no flight to come back, then how do you finish your clinical training so that we can make you graduate? So I guess those are all the considerations that we have for you. There are times that the student doesn't like us because they want to they want to go to the places that may be related to, they really want to go to a country that, they have some family there, but we do need to make the tough call to ensure the safety of the student. And the selective is the quality assured, is the placement that essentially we have the relationship with. They can be local in Sydney, in Australia. And we are also looking at some rural placement that currently so the student can actually go there in a setting that we know that you have a good time. Again, medicine is so much to learn. Basically, there's unlimited learning, but the selective is more that you can choose. You might be wanting to do surgery, for example, or you might want to do orthopedics. You might want to test yourself a little bit more about, is it the right specialty for you to do? That's when you will choose different specialty and will help you to do that. So this is the slide. You should take a picture. You need to have a bachelor degree, and then you have your GPA that will need to be 5 out of 7 at graduation when you complete the study. And you need to have minimum of the GAMSAT score of 50 to be considered. Also minimum of 50 in each session. But on average, that the mark of the GAMSAT to score an interview is higher than 50. And the people will use the GPA and the GAMSAT for the selection of the interview, the MMI, the multiple mini interview. Then I guess after that, we will use the MMI score and the GPA score to decide whether we give you the offer. So this is important. I presume all of you have done GAMSAT now, and all of you have really finished. This must be the last year of the undergrad degree. If for those that is applying this year, hopefully everything goes well, and we hopefully to see you all at the interview. But remember to apply. If you don't apply, you'll never get an offer. So we use the GAMSAT system, so they're open on the 1st of May, and it will close on 29th of May. And once they close, it cannot be open because it's a centralized system. So do not miss the deadline. And that's the Sydney time. So that for people living in Perth, that just make sure there is a Sydney time. And the interview that have set up is on the 26th of September. We will encourage everyone to turn up on site, the local, but we do occasionally interview students for the international candidate. And we will talk more. I guess this is just an overview. I'm sure that everyone had a lot of questions, but write them down. We'll answer all the questions for you.
Thank you, Vincent. We actually have some of our specialty admission officers who are outside at one of the booths. So if you do have really specific questions around admissions, I will direct you where to head afterwards for those of you who are here in person. For those of you who are online, you'll get links as to who to contact to be able to ask those questions from. So thank you, Vincent. Vincent has just had a seat, but I'm going to get him to get back up again very shortly. This is another one where you might want to get your phones out though. If you would like to scan the QR code at all, it will actually take you to our Course Finder webpage, which gives you all of the details that Vincent was just going through as well. It sends you through to a specific Macquarie MD page too, and there's always that Apply Now button for you to click on to be able to start your process of coming to join us here at Macquarie. So now we get to the part which is the best part of the night. It's the panel Q&A. So I would like to first of all invite Vincent to return up if he may. So we're going to have our panel sitting down here. So you've already met Vincent. He's been very quiet so far this evening. We're going to see a bit more of his personality come out shortly, I think. So thank you very much, Vincent, for joining us. I would also like to invite Associate Professor Janani Mahadeva. Janani is our stage 1 lead here in the Macquarie MD. So when you start the MD, Janani is the person who you go to initially, and she helps guide you through those first 2 years of the degree. She's also a general practitioner here on campus in the MQ Health Clinics, and she's currently undertaking research on the use of artificial intelligence in medical education and voluntary patient enrolment and genomics in primary care. Thank you, Janani. Next up, we have Dr. Gareth Mason. So thank you very much, Gareth. Gareth is one of our alumni who is now back with us here at Macquarie, contributing to the teaching of our Macquarie MD students. He graduated in 2022 with the University Medal. It's very impressive, Gareth. And he's now undertaking general practice training in Northern Sydney with special interests in chronic disease management, paediatrics and minority health. And last up, and possibly the most important person you're going to have here tonight, is Nora Lee Duhee. Now, Nora Lee is a second year Macquarie MD student, so you get to hear from our students as well as our alumni and staff as to how they find our degree. So Nora Lee has a background in medical research, and she actually completed her Bachelor of Clinical Sciences here with us at Macquarie as well. Her current interests in medicine are cardiology, orthopedics and paediatrics. So thank you all for joining us today. So we've got a couple of pre-prepared questions, which are the common ones that come at us on a regular basis for the panel to answer. And then after that, we'll have the opportunity for you in the room and those of you who are online to be able to submit your own questions and ask even more of our panel. So I'm going to start off with Nora Lee and with Gareth, okay? I'm going to go to Gareth first, if I can.
Take that.
I'm wondering if you could tell us why you chose to come to Macquarie to study the MD.
That's a pretty easy question. I was here already. I was doing the Bachelor of Clinical Science. So I started out moving from high school to Macquarie to do the Bachelor of Clinical Science. And that's a 2-year accelerated program. Some of you may have done it or you might have heard about it. And that was because I had a strong passion for medicine and clinical research as well. And I went through that program. And then just while I was doing that, the Macquarie MD was established. And I looked around at my teachers. Some of them still teach today, and I actually work with them now as well. And I thought, hey, this is a fantastic place. Everybody is so supportive. Why don't I just continue on here? The cohort was a small size in clinical science, and then that continues through to the medical program. So I thought, if I've already got a really tight-knit group of friends here and we're working towards medicine, why not continue here at the Macquarie MD? The other thing that was a really big selling point for the MD was the establishment of Macquarie University Health. So right now, just behind you is the Macquarie University Hospital. And then we've got teaching clinics on the other side of the road and then research labs. So I thought, it's all here. Why should I leave? So that was the big reason why I stayed.
Thanks, Gareth. What about you, Nora Lee?
Very similar. I also did my Bachelor of Clinical Science here. And I think one thing that I didn't expect from university was like an overwhelming amount of support. I remember coming from high school and everyone saying, in university, you do it all by yourself and, you know, you're on your own, you fend for yourself. And I got so nervous just going to university. And then when I started my Bachelor of Clinical Science, I didn't feel any of that. I felt so supported. The staff just really wants to see you learn. Like, they're not here just for the sake of saying they're here to teach. They really want to see you grow and develop. And then when it came down to choosing medicine, it's a big commitment. I think we all know that going in. And I really wanted to make a decision that I felt comfortable with. If I was going to commit the next 4 years of my life and beyond, especially the study part, I wanted to make sure that it's somewhere I knew I was going to be supported. And I felt that in my undergraduate, and it carried on very well into medicine. I think I made the right choice there. I definitely know I made the right choice. The staff really want to see you grow and develop, and that was a big turning point for me. And just when I was looking at it, the curriculum is brilliant. Like, you start off by getting such a great foundation, and you are clinical from like almost day one, maybe not in a hospital, but they're teaching you skills that you need very early. And it's a great program to develop things that you may not even think of when you apply. So I think that was another big turning point. I saw the biggest chance for development as a future practitioner here at Macquarie. So those were the two big things for me.
Thanks, Nora Lee. Here at Macquarie, we do say students first, and we genuinely mean that, all of the educators who you get to work with, and that we put students first in all of our decisions when we are working with you, when we're in the classroom with you, when we're marking your work and interacting with you as well. So it's so nice to hear you felt it. Janani, can I ask you a question now, if I may? What would be the main piece of advice that you would give to prospective students who were thinking of entering the medical profession and specifically here in the Macquarie MD?
All right, thanks, Verity. So I think one of the key things about being a doctor, and you often hear about it, is that it can consume your life. But I think it's such a privilege, and you really need to keep that in mind all the time. We are with people at their highs and their lows and listening to their stories. And as a GP, I get to see patients throughout their lifespan. So it's not just a one-off interaction. I get to know them very well. I get to know their families. I understand their psychosocial context. So that is an enormous privilege to be a part of someone's life in that way. I think the other aspect is to always keep an open mind. So opportunities will present themselves, and don't ever shy away from stepping up to an opportunity or to step into a role, when it's presented to you, because it's only there because you have the capacity. So those are probably my two biggest pieces of advice.
Thanks, Janani. Vincent, you've told us a bit already about the Macquarie MD, and you've done it in a very well-structured way. So thank you. Can you give us now why students should come here? Why choose Macquarie MD? Like, for you as our course director, what is it that you think we really have which is unique?
Oh, this is a loaded question. I mean, one thing that I would distinguish us from other university is that people here, most of us that are still active clinicians, and we are actually developing a culture that we always can help each other. Because I think that when we see some of my old mentor and others, that they seems to be always on their own. That whether they are clinically, they are some of the older surgeons, they are on a single doctor's practice, that their patient is their patient. They work 7 days a week and things like that. But I think the culture is Macquarie that I can rely on any of the one in my team that, when I need to go away, I just have to tell them 2 weeks in advance I'll be away. And I can actually just go, because I don't actually have to worry about it. I think that at a time that I think there's a lot of misnomer is about that you are the doctor. You need to be committed. You need to do for this. You have no time off. You are working every day, 12 hours a day, 365 days a week. It's not like that anymore. And I think that at the moment that at Macquarie, we know the whole team, that they are student-centered, that we are also not just looking after you, we're looking after each other too. That we actually can see that if we are not happy, you won't be happy. I guess it's like this is the things that I feel that the team at Macquarie is different from other university that I have worked with in the past. That previously are just a number, but in here we actually see more ourselves as a one family. We are one family looking after the next generation. We want you at the end to look after us. So I feel that is the different. That's why I mentioned about the small cohort. I think it's very different. As a business get bigger, actually become very hard, that it become more running like a business. But at this point that I will see that with our cohort size, we still one family. We still like a family business that is running what we want to do without, there's some restriction, but we can normally get it through, so we can still run the things that we would like to run. We like to make the best teaching that we can run, because we know that certain time that we want to try things, that we want to test this and that for your experience, so that you can actually in the best environment to learn. So I feel that is probably the difference that compared to other universities.
Thanks, Vincent. I think Gareth wants to add to that as well.
I was just going to say, if you want an example of the kind of student family that Vincent is talking about, Vincent has a love of bubble tea and has been known to buy some for the students. So he really shows that.
I was just going to add that when I went through medicine, I was one of 360, and I don't think I really got to know my educators or for them to know me. I was just another number. So I think here we get to know each and every one of you, which I think is a real positive part of the degree. And then we invest in you as well. So like we bring back a lot of our alumni, like Gareth, who are quite motivated and keen. And Gareth, I think, has gone full cycle. So he's come back to teach initially when he was a junior medical officer, and then to come back now as an academic GP registrar. And Gareth was in my tutorial group in year one. I was your first tutor. So it just means that we work towards making sure that our graduates, you know, can work up their CVs, that they are competitive in the workplace as well.
Thanks, Janani. Oh, are you going again?
I just want to mention the bubble tea. This is very important. On site that they have the child time, but Macquarie Shopping Centre is unlimited bubble tea brand. So it's very important.
Thank you, Vincent. Janani, can I ask you a question? Obviously, as Stage 1 lead, you're the one who welcomes new students in. What is it about our first year, our first stage, that really sets our students up to be ready to go out on placements and to welcome them here to Macquarie?
Yeah, definitely. So we're quite structured across years 1 and 2, and getting to know you as a small cohort is a big part of that. So in year 1, you go through the foundations, which is applied medical sciences, your pharmacology, physiology, immunology, and at the same time, you're learning about how to take a history from a patient, how to examine them, how to do some basic skills like an ECG. All of our tutors, except 1 or 2 in year 1, are GPs, so they have a very holistic approach to teaching and to learning for you guys as well. So I think that really does set us apart. We do have a focus on interprofessional learning that we mentioned before. So one of our units in year 1 is co-taught with the Doctor of Physiotherapy students and audiology students. And we find that those are really rich learning experiences, and you can learn a lot alongside each other. So that's probably what's unique about Macquarie for year 1. In year 2, we start our clinical immersion, and because we have our hospital here on campus, students start placements there. We do also send some students to Northern Beaches hospitals and to some other sites as well. So we find that our students, by that point, the nerves are out. You've prepared in year 1, you've been talking to your colleagues, you've attempted taking histories, you're quite confident going onto the ward in year 2.
Thank you. I might just go to you then, Nora Lee. How did you feel going out on your first placements?
It was unreal. Like, it's always nerve-wracking. You know, you get the email saying you are going here, and you take everything that you've learned from year 1. And I have to say, honestly, you come out feeling prepared. I mean, I don't think anything ever prepares you for seeing like a patient for the first time completely, but I don't think I could have been better prepared. We have so many times where we get to perform, say, a history or an exam or a skill that you may be required to do on the ward in front of your tutors, in front of people who can give you feedback like consistently. And that's something that I learned really quickly was a great opportunity. We have little mini assessments, you know, every 2-3 weeks, and a lot of people may freak out about that, but they're nothing crazy. It's just a chance for us to actually practice what we need to know. And we're doing that so early that when we actually get out there, we can give things a shot and actually learn from real patients, knowing that we've got a really good foundation. So I think it helped me immensely. I can't explain. It's been brilliant. Yeah.
That's great. While you've still got the microphone, what's been your favourite part of the Macquarie MD so far?
I've actually really enjoyed the whole thing. I won the cohort. Just, I think we've mentioned it a few times, a small cohort, but being actively in it and being only a year in, everyone knows everyone. Not only students knowing each other, but staff knowing you like by name. Like, you walk into a class and they know who you are with or without your name badge, which is, I don't think, something that happens quite often in university. So I think that's brilliant. Also, just there's so many opportunities to learn, and I think that's something that if you're going into medicine, you need to want to learn. It's like Vincent said before, it's unlimited, and there's so many opportunities. We get to see patients so early. We go in with tutors, they teach us things, they show us things. There's been so many just chances to see new things and learn. It's never been boring. Like, I can't say there's one highlight. The whole thing's just been so interesting and such a great opportunity. So I'm a big fan, if you can't tell. Yeah, I've loved the whole thing. It's been great.
Thank you. Gareth, maybe you can pinpoint 1 or 2 things which were your highlights.
Yeah, I agree with everything that you've said. I love the whole program start to finish. But if I was to kind of pinpoint one, I'd say in my third year, I got to go to Northern Beaches Hospital over in Northern Sydney, and I was working on the cardiology team. And going in, it was just after COVID, so everybody in the hospital system was kind of a bit stressed and working really hard. And I was incorporated as just as a member of the team as a junior medical officer would be as a medical student. There's often a tendency sometimes in medical training to have the student kind of relegated to the corner to watch and make sure that they're learning from afar. But the quality of the teaching was just so excellent. They had me involved. I was doing procedures on the ward, talking to patients, and just being immersed and respected as a member of the team, even though I wasn't necessarily had the title doctor yet. So I think that really just kind of solidified how great the teaching experience is. It made me way more confident in terms of my clinical practice and how to work with patients and how to work with teams. And then I took that forward into my medical career. So when I did start internship on the first day, and just like your first day of placement, nothing prepares you for the first day that you have doctor in front of your name and you're actually responsible for things. But having that really great educational experience, I think really, really helped.
Excellent. Gareth, did you go to India?
Unfortunately, I didn't. I was in year 2 when COVID hit, and it was all downhill from there. But then it got better.
So, Vincent, what do students say about India in terms of an experience heading over to Apollo?
I guess COVID was a problem because when we remember correctly that the India student that the first cohort went, then I think they were there they originally was going there for 20 weeks. But then on the 8 weeks that we have to bring them back. And at the time we run a Zoom meeting, everyone was crying. We're not going to come back. We signed a life away. We are not going to come back. But at the end that the Vice Chancellor and I convinced them you are coming back. So once we decided to come back, basically I told the student, because they love there so much, but we need to get them back on time. Because remember on those times, you guys might be too young. Because there was a curfew. You need to land back to the country by a certain day, otherwise they lock you out. So we essentially at that time that, I don't know why we make those promises. We tell the student, just pay with your credit card. When you come back, we'll reimburse you. So basically everyone was coming back from Sydney, from different places. I guess why I mentioned that is the student was liking India so much, they really don't want to come back. Like, I guess that is the things that, when you work in a different system, that in a structural way, they're learning so much there. They are immersed in not just the work, but also immersed in the life. They go to, basically anyone's wedding in India, you're invited. And normally 1 for 3 days. So basically everything that I see on Instagram is every weekend, they either traveling, go to Taj Mahal or other places, or they're in someone else's wedding. And they all dress up. So I just thought that, this is what a culture to experience. I guess it's and also they learn too. At the beginning, they were cooking themselves. Now they don't cook anymore. Apparently now any food is just $2. They just order, not Uber, the Grab equivalent, that they just order food. They are just enjoying, it's their amazing time. It's just about that they go as a group. I think that this is another thing that you are going together in a group of like-minded people. They travel together, they learn together, they get to the accommodation, to the hospital together. They're learning a lot of things together. There are times that people see that, why do I want to do that? But once you are working in a hospital, you know, you actually need to work as a team. Otherwise, you don't survive. Because hospital is a teamwork place. In not just the hospital, any of the medical practice that you're going to work in, is all about teamwork. So I feel that, like we didn't talk about stage 2, but the years 3 and 4 is more about we giving you the opportunity to try to work as a team. Ultimately, every single one of you, there's no quota of how many of you need to fail. basically we want everyone to get through once you pass the standard. I think that there's some older university that they say that, we need to fail 5% of the student and things like those things doesn't exist anymore, at least to my knowledge. So anyway, I got off track, but India is good. But I did bought my wife one of those India dresses. She didn't like it, but I got a wrong size. So there's another problem.
Did I have bubble tea?
The 5th time I went there, they have bubble tea.
Excellent.
It's chai.
It's chai. But the KFC is good, I can tell you. I went there first time, once I land, I found a KFC. Because everywhere I go, I will try McDonald's and KFC, every country.
I'm yet to do one of these without Vincent talking about KFC and bubble tea. I'm going to go to you now, though, for our last question, Janani. What do you think is the future of medical education, and how are we setting up our students to be ready for the future of the profession?
So I think in our video, we alluded to the fact that digital technologies are obviously advancing and increasingly becoming integrated, even for us in day-to-day life, but also in medicine. So now in general practice, a lot of us are using artificial intelligence scribes. So you might have gone to the doctors and had them turn it on, or you might be working in a practice and seen it in function, but essentially you're talking to the patient, it's taking a transcript of the conversation and giving you some output. So that's a very basic functionality, but as you hit the workforce and become clinicians of the future, that will develop, and who knows where we'll be at. So really it's about us recognizing that the role of medicine in the future will be different, and preparing you as clinicians who can adapt to that environment. So that means that we've looked at things like integrating teaching about artificial intelligence into our curriculum. And we're also thinking about workflows and how that looks like in the workplace, both in hospital settings and then out in the community.
Thank you. Okay, now it's time for questions from the room and from online as well. So we're going to have some microphones going around the room. For anyone here, please raise your hand, but I've already got some online questions. So I'm going to go to Noralee and Gareth for these ones. Or the first one, any top tips around studying your bachelor degree, particularly if it's something like clinical science here at Macquarie, which is an accelerated degree, while also preparing for the GAMSAT? So top tips we're after for some of our online audience members.
Start early, I guess. It's a good tip. The GAMSAT is for those of you who haven't done it, maybe earlier on in your medical admissions journey, it's a science-based exam, but then there's also some humanities component to it as well. It's a big exam. It sometimes goes for up to 6 hours. At least it did when I did it. So there is a lot to learn, but there's a lot of overlap with an undergraduate degree, particularly if you're doing a science-based degree like clinical science or a Bachelor of Medical Science. So a lot of what you learn in that area will also translate across. So you don't necessarily have to do too much above and beyond what you're already doing. And then in terms of tips for it, reading widely, knowing the news, knowing current events helps. But I think starting early and then having a plan, doing a little bit each night or a little bit each week will be very helpful, rather than just waiting until the last month and panicking. Did you have anything else?
I think doing your undergraduate too, I think it's really important while you're studying your undergraduate to learn, not just like memorize things and just prepare for an exam. I know exams are important. We all know exams are important, but it's also important to, while you're in your undergraduate, get a good basis, get a good foundation as best as you can. For the GAMSAT, I just saw it as like a little adjunct. Like while I would be doing something for my undergrad study, I'd set a timer for say, 30 or 45 minutes and write one practice essay, or, read up on something new, or do, 10 or 15 multiple choice questions for the science section. So like Gareth said, little bits every night kind of accumulates, but I don't think it's really hard to, maybe when you're getting closer to GAMSAT, it's easy to neglect maybe your undergraduate or vice versa. So I think it's good to find a balance and find that early, and use every opportunity to really build your base of knowledge, not just for an exam, but for future. Because when you start medicine, it's a lot, and having a good foundation really, really helps. So I can't stress that enough. Coming in prepared from your undergraduate while preparing for your GAMSAT is important, I think. Yeah.
Thanks, Noralee. We have a question down the front, if I can get you to prep, but I will quickly ask another question which comes on from that, because online they've asked whether or not Macquarie will consider graduates from other non-medicine or non-science related courses.
I guess you see the criteria. We look at the GPA and the GAMSAT score. So if you are the non-science degree, it's fine as long as you fulfill the criteria, you rank high enough to get an offer. But we do prepare the non-science candidate that there is a crash course that we offer in January, like end of January, before the year one start, so that those students can actually learn so that they can get the basic to start the science again. Because year one, as we mentioned, that they are the crash course for all the science again. But we do, we encourage to the non-science people to apply, because we actually like to see students from a different background. We like to see, there's a few of our students are lawyers. There's others, some is work for IT. So we like people that come from different background, because that actually make medicine is interesting. You actually can find a role that, compared to dentistry, you only ever just work in your mouth. But medicine, you can actually do anything that somehow you can create a specialty for yourself. Like if you want to, like you can link up with all the skills, you can actually do one. So there's many examples of that, like, that I can talk more, but.
Okay, we might go to a question in the room. Thank you.
Is joining the GP intensive stream voluntary, or are students selected to do that?
I could probably speak to that. So it's actually quite highly coveted. So we have an application process. Students put a expression of interest essay into us. It's short, it's not too onerous. And then we run interviews. So we actually find, like this year, for the number of positions, we've almost had double the number of students apply. So it's quite popular. A lot of the placements that we offer are niche in particular areas like palliative care, women's health, skin medicine, and we just find that students really get a lot out of it. And I can say as a GP that we know at the other end with the workforce shortage that positive role modelling is one of the early sort of factors that can have a strong impact on someone wanting to have a career in general practice. So we take that seriously, and we try to make sure that you have a really good experience in the GP intensive stream.
Got some more questions about placement from online, but if there's anyone else in the room with a question, we've got microphones if you want to head in the right direction, and I'll just ask this one in the meanwhile. It's hopefully a quick one about India, if there's any costs involved with that placement.
The return ticket is covered, the accommodation is covered, but going to travel inside India is not covered. Also, food is not covered. I guess it's like you can ask the apartment that we lease, that you can actually get them to get you food. You just have to pay them. So they actually have a internal kitchen that they actually can provide. So in general, that people found the cost of living is actually quite low. That they actually they never cook anymore. They just eat out. Yeah.
I think in adding on to that, we also do get $1,600 spending. So they do give us to cover things like food while we're there. So it's not completely out of pocket as well. Yeah.
Thanks, Noralee. We've got a question over here in the room.
Hey guys, and thanks for speaking tonight. For Noralee, a question for you. What sort of skills do you think prepared you really well to start on placement that you learned in your first year?
So starting in year one, we get a really good medical science kind of physiology, anatomy background. But on top of that, we also start really early on taking system-specific histories. So we do like a cardiac history, a respiratory history, gastro, all the systems you can possibly think of, and their associated physical exams. On top of that, we also learn things like ECG, oxygen masks. We do things like puffers and spirometry. We learn so many skills in year one, and we have so much chance to practice them, and we lead into our OSCE. But I think focusing on those and kind of practicing those and thinking clinically, relating it to its anatomy and physiology prepares you well when you go on placement, because we've had a chance all year to start practicing things like talking to a patient and knowing what questions to ask, knowing when things are red flags, and kind of having a really good base clinical knowledge. And then when you go out, you see that all happen in person and you're like, wait, I know, I was going to ask that too. Like, so things like that I think is really good. You learn a lot and you learn it quite well, and it's very clinical, like clinically applied from day one. So yeah.
Oh, could you just repeat the question for us, just so people online
Sure.
can hear?
What was the hardest part about starting placements? Like, what was the most difficult thing?
Honestly, it's actually more relaxed than you think it is. I think the hardest part was like your nerves as a student going in, not knowing what to expect. Everyone that I've been with, every placement that I've been put on, they're keen for you to be there. They want you in the room, and they, you know, like the doctor I was with recently in endocrinology, it was like every blood pressure, weight, height, measurement. He was like, "Can you go do that?" I was like, "Yeah, I can do that." Like, they really want you to learn. So I think the hardest part is getting over your own kind of nerves and getting into placement. And just maybe sometimes the preparation, like you want to go in to say endocrinology prepared, knowing a bit of endocrinology, but it's nothing tricky. It's actually a really good learning experience. Yeah.
Thank you. We had a question here in the room as well.
For the elective placements, is there an opportunity to do the less patient-facing specialties like pathology and radiology, or is it more the typical ones?
As I mentioned, elective is up to you, as long as you let us know what learning objective that you want to do. We have students that been to Douglas Henry Moyer to look at pathology, like look at the slides for 4 weeks with the pathologist, go to all the different meetings. We have students that been to our Macquarie, our own radiology practice, Macquarie Medical Imaging, to do the elective. And you can choose to do in other location, like in Sydney or even overseas. So it's all that option.
Got another question just over here in the room.
Okay, so I might be misunderstanding how the structure works with the whole India placement and then GP thing. But you said the GP part was like kind of exclusive or coveted. What would happen to like a student who might not be able to like go to India for like personal reasons or like safety reasons? Do they get like kind of automatically in the GP stream, or what happens there?
We didn't mention on the slide, but we understand the students that there's other consideration. So there's also a stream called inclusive stream.
Mhm.
So they will have a different program.
Okay.
Like during the time that is not India, is not GP intensive, but
Okay.
there'll be like usually we'll find them other placement in a hospital setting.
Okay, cool. Thank you so much.
Thank you.
Hi, thank you again for everything we've learnt this evening. I just wanted to ask, as it seems the course is full fee paying, are there opportunities for students from low socioeconomic backgrounds to apply?
Yes.
The short answer is yes. There is a few scholarships that actually provide, but I don't know the number. I think there's 2. Is that right, Rachel?
Right behind at the back of the room there, we have one of our specialty admissions people, Rachel, who's just going to answer this one for us, and then I have another question for you.
Yeah.
Thank you.
So as far as scholarships for equity, it's focused in stage 2. So the first 2 years would be full fee paying, and then people can apply for the scholarships for year 3 and 4, which is stage 2. And there's 4 of those that are available. And that's normally where students find that fee help runs out. So that's where those scholarships are based, to make sure that we can support the students getting through those final 2 years.
And one more question for you while you've got the microphone, Rachel.
Could I just add to that before
Yes.
we move on? Is that all right? We do also have First Nations student scholarships, and we have the teaching and leading scholarships as well. So there's a significant number that we find that students can apply for based on which categories they're able to apply for.
Thank you.
And also it's like around Macquarie Park, there's actually a lot of working opportunity during the COVID time. Basically, like many of our students actually working in the COVID clinic around this area. So there are actually working opportunity. I don't know whether many of you know that there's a WISE clinic around in Macquarie Park behind the Macquarie Shopping Centre. You know, a lot of our students are there as a receptionist, as a medical scribe, that, you know, they actually do part-time work there while they're studying here full-time as well. So I guess there are opportunity. You're actually doing medical related work and also getting paid, and also you are studying and it's nearby. They were telling me one point that they are the biggest employer of our medicals, basically our student in Macquarie.
And WISE is the walk-in specialist emergency centre. So that's how you get to see all the medical procedures at the same time. Very last question, which has come from online. And Rachel, I'm going to you for this one, if I may. One of our online participants has asked if they have a bachelor's and a master's degree. Will only the bachelor's be counted, or could you advise on that?
No, so the master's...
With the microphone.
Sorry, not
Thank you.
Sorry. The master's degree can also be included. So in the calculation of the GPA, it's the master's, and if it's a 1 year, then you'd go to your 3rd year of your bachelor's, and then the 2nd year of your bachelor's. If it's a 2 year, then you 2 years and then down.
Excellent. Thank you, Rachel. So I'm actually going to have to wrap things up at that point in time, but let you know a couple of things just to finalise this. So anyone who has attended here today, either in person or online, you will get an email from us after that. And as part of that, there will be contact details. So if you do have more specific questions or the generic questions as well, please feel free to reach out on that email and to ask away, and we'll be able to respond to you there. If you are here because you're interested in health and you're interested in helping other people, we actually have more postgraduate health webinars which are being held tomorrow night. So between 5 and 5:45, we've got the Master of Public Health covered, and 6 to 6:45, the Master of Chiropractic and Doctor of Physiotherapy. They're both just online, but the course directors will be at each of those telling you a bit about the courses, and again, having an opportunity for any questions that you might have as well. So you will also see, you can register there on the QR code if you are interested. So thank you very much to everybody who has come tonight, either in person or if you are online. For those of you who are online, what we are going to do now is take you through a virtual facility tour. So I will leave our online participants with that.
Hi, I'm Pravini, and I'm a student ambassador in my 2nd year of the Doctor of Medicine program. Sometimes we know that it's not possible for you to make it onto campus, so allow me to give you a quick tour of some of our key facilities that would matter to a student hoping to study medicine at Macquarie. We'll take you through 3 key areas that are conveniently located a short walking distance from each other. So, welcome to the Ainsworth building, affectionately known as One Wally's Walk. It is located in the heart of the health precinct, with the hospital on one side and the faculty office and research on the other side. This is philanthropically donated from the Ainsworth Foundation to provide a central hub to train the next generation of health professionals. Lectures and tutorials within the Macquarie MD program will primarily take place here. So let's go have a look inside. Here we're inside the foyer of One Wally's Walk, where our students are able to sit and study and socialise with their peers up on these steps as they wait for their classes to start. This is GO3, one of the largest lecture theatres we have for our MD students. It seats 200 students and it's a hybrid theatre, meaning students can attend remotely and still participate in classes. So now we're in room 102, which is one of our 90-seat lecture theatres, and it's a hybrid room, modelled after a case study done in Harvard regarding the best ways to teach an MD program. This room is designed with collaboration and hybrid in mind, and it has a direct Zoom feed to students who are studying remotely, including those currently studying in Apollo, India on their clinical placements. This is another example of one of our hybrid learning spaces, where MD students will participate in their lectures and tutorials. So on level 1 and 2 of Wally's Walk, you'll find a lot of our collaborative learning spaces, where smaller class tutorials are run with specialist lecturers. One Wally's Walk was designed as a sustainably sourced building with over 700 tonnes of timber used in the construction. The building was designed to be surrounded by glass so our students can see out and witness patient care and research happening around them, and so those outside can see the education of the next generation within. So follow me as we head to our next location. So behind me is the crown jewel that distinguishes the Macquarie MD program from other medical degrees in Australia. The Macquarie University Hospital offers a new era in Australian healthcare. Based on leading international university hospitals, a 144-bed facility fully integrates clinical practice, research and education. It is located right here on our picturesque university campus and is conveniently located next to the Ainsworth building. This is a fully operational hospital with active clinical spaces and real-life patients. Unfortunately, we're not able to take you inside today, but I'd like to take the opportunity to highlight the importance of the hospital and why you should choose to study medicine at Macquarie. The hospital is part of MQ Health, Australia's first university-led, fully integrated academic health sciences centre. This space is able to bring clinicians, teachers, researchers and students under one roof to work very closely together in a focused way. This integration is reinforced through our mission of Heal, Learn, Discover, where the same doctors and health professionals are providing treatment and healing patients in our university-owned hospital and clinics, are also teaching the next generation of healthcare professionals in our undergraduate and postgraduate degrees, and those that are conducting research and discovering the next best treatments in our state-of-the-art research labs. By combining innovative technology, including one of the largest robotic surgery programs in the country, state-of-the-art facilities, education and research, and a commitment to providing compassionate and high-quality care, the hospital aims to deliver the best patient experience. Our facilities include 16 theatres, including 2 new angiography suites and a hybrid operating theatre, a 20-bed intensive care unit, a chemotherapy and day infusion centre, a medical imaging centre, including 2 3T MRIs, radiotherapy services provided by Genesis Care, inpatient and outpatient pharmacy services, 2 Da Vinci surgical robots, and we are the proud owners of one of only 2 Gamma knives in Australia. Behind me right now is the Macquarie Clinic building, which is home to the majority of our 35 health services and clinics that are available here at our university. It is situated literally across the road from the hospital and connected together by the overhead bridge. The bridge between the hospital and health clinics is symbolic of our motto, Heal, Learn, Discover, where doctors and clinical placement students are able to directly walk between their treatment of patients to the hospital and clinics, to the teaching rooms on the ground floor, and research wet labs on the first floor of the clinic building. Speaking of, let's check out those spaces now. So here we have one of the main lecture theatres at 2TP inside our clinic building. This is for immersive and collaborative learning. As you can see, these desks are movable, as well as this wall, which is collapsible and can extend into making a bigger room for our students. We also have monitors and projectors that come down for an immersive and collaborative learning environment. Let's go on and check out the simulation lab where the students do a lot of their learning. So here we have our simulation teaching lab, where our students are immersed in lifelike scenarios, which prepares them well for their clinical placements, whether in the clinical building or over in the hospital. So let's go have a look. So here we have what is probably one of the coolest rooms in the clinical building. This is our simulation lab. As you can see, we have some very lifelike mannequins, which blink, breathe, they even bleed. So the whole point of this space is to immerse our students in as a lifelike scenario as possible, which will prepare them well for when they start on their clinical journeys with placements in the hospital or in the clinical building next door. What we want our students to do is to be well prepared for what they might face out in the world. So we're not only testing their sense of sight here, we're also testing their sense of hearing, smell, and touch, allowing our students to practice the clinical skills that they learn over their years with the MD program. So we're now about to enter into our clinical tutorial spaces, where our students are learning in smaller groups. Let's go have a look inside. So here we have one of our tutorial spaces, where students work in smaller groups with their tutor and are able to practice their clinical skills in a room that mimics what they would find in a normal clinical building. Something to look forward to as an MD student is practicing your clinical skills in a collaborative learning space, such as plastering on each other and learning how to scrub in for theatre when you do eventually go into the hospital. This is our student space, which is restricted to just our MD students. Here, students from all year levels are able to relax in a space provided just for them. They've got couches, tables, chairs, and even a kitchenette provided for their use. The space is quiet at the moment, but all of our students are currently in class, so this area will be bustling in no time. This brings us to the end of our tour. Thank you so much for joining me, and we look forward to seeing you on campus.